How do specialists review complex lymphoma cases? When a person is diagnosed with lymphoma, especially if the case is complicated or unusual, a team of medical experts carefully reviews all the information to make the best treatment plan. This process starts with a detailed physical exam, where doctors check the lymph nodes and organs that might be affected. Blood tests are then done to look for abnormal lymphocytes, check how well organs are working, and screen for infections like HIV or hepatitis that can influence how lymphoma behaves or responds to treatment. Imaging tests such as CORT scans, PET-CT scans, or MRI are used to see exactly where the lymphoma is located and how far it has spread. Knowing the size and position of the affected areas helps doctors determine the stage of the disease, which is crucial for planning treatment. To confirm the diagnosis, doctors perform a biopsy, which involves removing a sample of tissue from a lymph node or other affected area. This tissue is examined under a microscope by specialized pathologists who look at the cell structure and perform tests to identify specific markers on the lymphoma cells. These markers help distinguish between different types of lymphoma, which is important because each type may requiring a different approach. For complex cases, the specialists come together in a multidisciplinary team meeting. This team includes hematologist-oncologists, pathologists, radiologists, and sometimes surgeons or radiation oncologists. They review all the clinical information, imaging results, and pathology findings together to reach a consensus on the diagnosis and the best treatment options for the patient. Additional tests like cytogenetics and fluorescence in situ hybridization are sometimes used to find genetic abnormalities in the lymphoma cells. These details can help predict how aggressive the lymphoma might be and guide the choice of therapy. Specialists also determine whether the lymphoma is slow-growing or fast-growing, which influences whether immediate treatment is needed or if careful monitoring is appropriate. If a patient seeks a second opinion or wants to understand their treatment options better, this thorough review process by lymphoma experts ensures that the diagnosis is accurate and that the treatment plan is personalized. It's always a good idea to ask your healthcare team if your biopsy has been reviewed by a lymphoma specialist and if your case has been discussed in a multidisciplinary setting. This collaborative approach helps reduce errors and ensures that you receive care based on the latest evidence and guidelines. In summary, reviewing complex lymphoma cases involves a careful combination of clinical assessment, advanced testing, expert pathology review, and team discussions to develop a precise diagnosis and tailored treatment plan that aligns with current medical standards. Remember, every case is unique, so working closely with your healthcare team is essential for the best possible outcome.